are going to go ahead and get started. It is my pleasure to introduce Dr. Elena Philippou. She is an associate professor of nutrition dietetics at the University of Nicosia and a visiting lecturer in nutritional sciences at King's College in London, UK. Her research focuses on diet for prevention of degenerative disease and more specifically, the effects of the Mediterranean diet, chrononutrition, and carbohydrate manipulation on cognitive function, cardiometabolic factors, and rheumatic disease. Her research aims to identify dietary factors that can prevent disease and/or improve outcomes. She has extensive experience as a practicing dietitian, advising adults and children on diet-related issues for the last 20 years. She's also the host of a growing YouTube channel where she posts educational videos. And I also want to mention that she did an episode of Spondycast for us, and that has been the second most popular podcast episode we have. So we know a lot of people are interested in diet and nutrition as it relates to spondyloarthritis. So welcome, Dr. Philippou. We're excited to have you here, and I'm going to stop sharing my screen so that you have the controls now. Thank you.
Thank you, Melissa, and thank you, Spondylitis Association of America. This is a real pleasure to be amongst you and present on diet and rheumatic disease. So let's start. Okay. So just to start with some disclosures, I am a co-author of several scientific manuscripts on nutrition and rheumatic disease, but I have no financial disclosures, and just a kind invitation not to take any pictures of the slides that we'll show. So I want to start with a question for you, just to get you thinking. So how do you think nutrition is related to rheumatic disease? Is it that an anti-inflammatory diet reduces the risk of rheumatic disease? Is it that a Western diet increases inflammation? That weight management plays a role in rheumatic disease management? Or a healthy diet can reduce disease symptoms? Or is it all of the above? I'll just give you a second to consider this. And yes, those who answered all of the above would be right. So this is what I want to show you today, that diet is actually associated with both the risk and the management of rheumatic disease. So to start it with, let's talk about the link between nutrition and inflammation. Back in 1989, Schoenfeld and Eisenberg introduced this mosaic of autoimmunity, where it is thought that rheumatic disease is an interaction, a complex interaction of immunity, genes, hormones, and the environment. And obviously, environment includes diet. And in all of this, both prevention, management of rheumatic disease, but also comorbidities prevention and management, what is central is inflammation. And inflammation is important for all of us. It is what helps us to get over, for example, an injury. And the body will respond to this injury by having a reaction called inflammation. But what we don't want is this chronic low-grade inflammation that happens in people with rheumatic disease, but also is thought to be happening in people with diabetes and heart disease. So those comorbidities that can also occur in people with rheumatic disease. So how is nutrition related to inflammation? How can healthy eating benefit rheumatic disease? I will show you that it can reduce inflammation, but it can also improve disease outcomes. It can help to keep our weight healthy and also reduces the risk of the comorbidities that we mentioned. And here are some factors just to give you a glimpse of what can help. So oily fish, for example, can reduce pro-inflammatory cytokine production. Cocoa found in dark chocolate contains polyphenols that are shown to increase anti-inflammatory cytokines, so they also reduce inflammation. And a favorite red wine that contains resveratrol reduces reactive oxygen species production, so reduces oxidation in the body. So all of this can help reduce inflammation. But unfortunately, we're moving away from this healthy diet towards a westernized diet. And it has been shown, for example, in this study, that there is an association between the dietary inflammatory index. So the more the diet contains foods that increase inflammation, the worse the disease outcomes, and the worse the inflammatory cytokines in rheumatic arthritis patients. So the higher the dietary inflammatory index, the higher the scores in things that you see in your bloods, for example, CRP, tumor necrosis factor alpha, and the DSA-28 score, and also the number of tender joints. On the other side of the scale, in a case control study in 200 patients with rheumatic arthritis and 200 patients age controlled, so those people who did not have arthritis, the anti-inflammatory index was associated with better disease outcomes. But even more importantly, those people including foods in their diets that were anti-inflammatory maintained low disease activity for the follow-up of the study over 6 years. And in a study that looked at a number of different studies together, so they meta-analyzed a lot of different studies together, as you can see here, anti-inflammatory diets reduced pain and also had an improvement in C-reactive protein, so an inflammatory factor. So in your bag, as a take-home message, I would ask you to put this message: nutrition does play an important role in inflammation. And although most of the evidence comes from rheumatoid arthritis, there's no reason to believe that this doesn't apply to other rheumatic disease as well. So can the way we eat influence the risk of developing now rheumatic disease? And in the study here, done by Sparks et al. At Harvard, they followed up in the Nurses' Health Study over 1,700 women. And what they did was that they looked at the dietary inflammatory pattern of different foods and beverages, and they found that in women aged less than 55 years old, increasing dietary inflammatory pattern was actually associated with an increased overall risk of developing rheumatoid arthritis. So the more foods that the diet contained that were causing inflammation, the higher the risk of developing the disease, as you can see here. And in another study, the Swedish mammography cohort, where they followed up 32,000 women, it was shown that the intake of long-chain omega-3 fatty acids, so mainly fish, was associated with about a 30% reduction in developing the disease. So if a woman was eating more than one serving a week of oily fish, she had 30% lower risk of developing rheumatoid arthritis. So another message to put in your bag, that diet does play a role in the onset of disease. Now, I think I have convinced you by now that the type of diet we eat does matter, but let's take a closer look at the evidence. Let's look at the pro versus the anti-inflammatory diet. And I want to ask you, which of the foods or drinks below do you think can reduce inflammation? And again, you can choose more than one. Chia seeds, salmon, fruit and vegetables, walnuts, or red meat. I'll just give you a second to consider. Okay, and those who answered the first four would be right, because those foods contain more anti-inflammatory factors such as omega-3, but also antioxidants and phytochemicals, whereas red meat does not. and in large amounts, it can actually increase inflammation. So why is that? What are these anti-inflammatory fats? Maybe you've heard of omega-3 and omega-6 fatty acids. And the only difference in between the two is the double bonds and where they are placed. So in the omega-6 fatty acids, they're placed on the 6th position, and omega-3 on the 3rd position from the bond. So omega-3 fatty acids would be found in oils such as olive oil, soybean oil, or flaxseed oil, and the larger EPA and DHA omega-3 in fatty fish such as sardines, mackerel, salmon, sea bass, sea bean. Whereas omega-6 fatty acids will be found in corn oil, soybean oil, peanut oil, and larger ones in meat, milk, dairy, and eggs. So why do we care about this? What is the importance in terms of inflammation? So if we take the omega-6 fatty acids and the omega-3 fatty acids, when they're converted in the body from the smaller ones, so for example, linoleic acid, which is an omega-6, and alpha-linolenic acid, which is an omega-3 fatty acid, they will compete for the same converting enzymes in the body. So if we're eating a lot of omega-6 fatty acids, we'll be converting more of those into the pro-inflammatory cosanoids, as you can see here on the bottom. Whereas if we're eating more omega-3 fatty acids, then we will have more of the omega-3 cosanoids in the body, which are anti-inflammatory. And we can consume omega-3 in the form of alpha-linolenic acid coming from, for example, flax seeds, chia seeds, walnuts, or even better, in the form of fatty fish, which is the longer chain ones, EPA and DHA, which are easily converted into the eicosanoids that are anti-inflammatory. Or we can do a combination. So which foods are good sources of omega-3 fatty acids? So we mentioned a few times up to now oily fish, which would be sardines, as you can see here, 1.36 grams in one portion. And I would say aim for about 2 to 2.5 grams per day. Salmon, 2.56. And then we also have walnuts, which is a very good source. We have linseeds, which is a very good source. But remember that this smaller chain will need to be converted in the body into the larger chain. So some of it will not be as available as in the oily fish. But again, I would advise you to consume different types of oily fish and not stick to one. So sardines are an excellent source because they're smaller fish compared to salmon or sea bass, which might also contain some heavy metal because salmon is a big fish. And if we go now and look at this, is there a point in consuming more omega-3 fatty acids? Does it help? And yes, again, in a systematic review and meta-analysis, it was shown that there is reduction in morning stiffness and also in the number of tender and painful joints if people with rheumatic disease consume 2.7 grams or more of EPA and DHA, so the long-chain omega-3 fatty acids per day for 3 to 4 months. So it takes some time to show the effects, but it does have effect. So another thing to remember is that it's important to consume food sources of omega-3 fatty acids, either daily, depending on the dose, or weekly. And you might consider omega-3 supplementation with at least 2 grams per day of EPA or DHA to reduce inflammation and improve symptoms in rheumatic disease. However, it's very important to consult with your medical practitioner regarding taking supplements. Now, another question for you. Which of the foods below do you think can increase inflammation now? So we saw before reduction. So what about increasing inflammation? Is it processed meat? Is it olive oil, salty snacks, pastries, or fruit? All right, and so those who answered processed meat, salty snacks, and pastries would be right, because red meat and also lots of salt and lots of sugar increase inflammation in the body. So let's have a look at this in more detail. Let's take salt, first of all. Salt increases inflammation by a number of different mechanisms. So it increases pro-inflammatory macrophages. It increases the potency and concentration of pro-inflammatory factors and reduces T cell function, which is important for reducing inflammation. So there are a number of ways by which salt actually increases inflammation. And here, this is a very important study, the SUN cohort. As you can see in the dark figures, the shadowed figure, those patients with rheumatoid arthritis, the more sodium that there was a dose-dependent relationship between the dose of sodium, which is salt, and the diagnosis of rheumatoid arthritis. And this association was much clearer in non-smokers, just because we think that the risk of RA is already high in smokers. So sodium increases the risk of rheumatic disease. How can I reduce salt in my diet, though? And how can you increase the anti-inflammatory factors in the diet? Obviously, limiting salt during cooking and at the table is very important, but also consider the use of stock cubes and flavor enhancers, for example, monosodium glutamate. Monosodium glutamate is found in lots of processed foods, such as crisps, and other sauces. Asian diets, for example, might contain a lot of monosodium glutamate. You might have heard of it as MSG. So anything that you see that has the word sodium in it is really a type of salt that needs to be limited. Then again, we need to also consider the consumption of salty foods, such as cheese, salted nuts, crisps, but processed foods, as I mentioned a number of times, do contain a lot of salt. But there's also hidden sources of salt. So for example, if we're consuming a lot of bread, then we're taking in more salt. If we're consuming a lot of cakes and pastries, they contain baking powder or soda, which is again a sodium bicarbonate. But now no one wants to eat a bland diet, so it's important to use herbs and spices to make our food tasty. And these herbs and spices, apart from making the food tastier, they also increase, they contain a lot of anti-inflammatory factors and a lot of antioxidant factors, and can even be helpful in reducing pain. So oregano, curcumin, cinnamon, parsley, garlic, etc., they can all be used to spice up our life and our dishes. And all of this information is even more important when using corticosteroids. So limiting salt is even more important if using these steroids. So what about sugar now? And sugar is found in many different foods. These sources here that you can see, we all know that they contain sugar, but again, processed foods will contain sugar, and this is a hidden source of sugar. So going back to the Nurses' Health study, in an analysis of more than 180,000 women, it was shown that regular consumption of high fructose corn syrup sweetened soft drinks, so the regular colas, but not diet soft drinks, was associated with an increased risk of seropositive RA in adult women. And this is thought to arise both because of inflammation, but also because of the high glycemic index of these soft drinks. So what happens when we consume a soft drink containing high fructose corn syrup? As you can see in the red line, what will happen to our blood sugar is that it will increase quite fast, and then it will drop suddenly as well. So this is called a high glycemic index response. So when the blood sugar increases, the body will produce insulin. So we have a condition where we have a lot of glucose, hyperglycemia, but also a lot of insulin in the blood, hyperinsulinemia. And insulin promotes fat storage. So we might notice that the consumption of these high fructose soft drinks regularly increases the amount of fat around the tummy area as well. And then following this hyperinsulinemia, there will be a point that the blood sugar drops even below the fasting. And here we have a lot of cortisol being produced. Cortisol is a hormone that we produce when we are stressed. So the body feels stressed, feels under stress. And again, this promotes a storage of fat. So all these reactions and the changes in the hormones are especially problematic in people with rheumatic disease, but I would say in any one of us as well. So what we want to do is avoid consuming foods and drinks that have this red curve and consume low glycemic index foods, which will produce a slow release of glucose in the blood and keep it low and not below the fasting, as you can see here in the green line. And I will show you in a minute which foods are those. But before I show you that, I want to show you actually some evidence in axial spondyloarthritis in the Sanud study. So here they followed up about 300 patients with axial spondyloarthritis, and they assessed their activity of the disease using different indices. And it was shown that the higher the disease activity was associated with a higher body mass index, but also the higher intake of ultra-processed foods, so foods that are processed and we cannot have the ingredients in the house to make them, and also low intake of omega-3 fatty acids and fiber. So another piece of evidence that high foods containing a lot of sugar and salt and a lot of processing will increase disease activity. So what to choose then? So what are some examples of low glycemic index foods? Foods that will not increase our blood sugar and not cause this extensive release of hormones. This will be beans and lentils, pasta cooked al dente, not a lot of cooking for pasta, whole grain seeded bread, as you can see in the picture, or rye bread, sweet potato, wild rice, oats and muesli, especially jumbo oats, big oats, and most fruits, including apple, pear, oranges, grapes, nectarines, and berries. So these foods are to be consumed and preferred. And foods that we should try and stay clear of or consume in less often, and those with high glycemic index, which would be white bread or brown bread, French bread, baked, pureed and fried potatoes, most types of white rice, most breakfast cereals, including those high fiber or diet breakfast cereals. So prefer jumbo oats instead of any other breakfast cereal. And melon and watermelon in big amounts, and things like rice crackers, rice cakes, and other foods that come in packages. So to sum up, moving from a pro-inflammatory to an anti-inflammatory diet. So pro-inflammatory diet would be that contains a lot of added sugars, that is high in glycemic index, low in fiber, high in trans fats that are produced in foods that undergo a lot of frying and processing, and saturated fats that are found in meat and cholesterol. Diets that are high in omega-6 fatty acids, limited use of herbs and spices, processed foods, and empty calories. So calories that do not provide any nutrients. So we want to stay away from this diet and instead choose an anti-inflammatory diet that is low in added sugar and salt, high in fiber, low in glycemic index, low in saturated, but high in monounsaturated fat. So for example, from olive oil, high in omega-3 fatty acids, high in phytonutrients, lots of fruit, vegetables, seeds, nuts, legumes, whole foods actually, and it's rich in vitamins and minerals. Now, we looked at different food components, but if we were to group everything together, I want to ask you, what do you think, which of the following dietary patterns is the most beneficial and also safe to follow in the long term? Is it the Mediterranean diet? Is it the ketogenic diet, the vegan diet, water fasting, or a gluten-free diet? So the answer here would be the Mediterranean diet, not because I come from a Mediterranean country, which of course it's important for us, but because it is the most beneficial and also safe in the long term. And I will show you how and why. So before I show you that, I want to show you the effects of Mediterranean anti-inflammatory diet. So here we have a randomized single-blinded controlled crossover trial where basically they took about 50 people who had rheumatoid arthritis, and they randomized them to either this diet here, that is an anti-inflammatory diet containing lots of nuts, seeds, fermented dairy, omega-3 fatty acids, legumes, as you can see, and good types of fats, to follow that for 10 weeks. Then they had 3 months of their own diet, and then they crossed them over. So the same people also consumed a control diet. So they consumed first either the intervention diet and then the control diet, or the opposite. But the same person did both diets. And what they found was that there was a significant improvement in disease activity only during the intervention period. And there was a significantly lower DSA-28 only after the intervention period, but not after the control diet. So there is some evidence coming in showing that it is effective, an anti-inflammatory diet containing lots of plants and omega-3 fatty acids and fermented foods. But let's go back to the Mediterranean diet, because not everyone understands what it is, and it's not just the diet, actually. So the Mediterranean diet, as you can see in the pyramid and also in the plate here, is mostly plant-based, but is not 100% plants. So on the basis of the pyramid, we have lots of foods coming from the earth, such as whole grains, legumes, extra virgin olive oil, lots of fruit, vegetables, and lots of color, actually, which is very important to consume what we say the rainbow, different colors every day. Then we have fish and seafood at least 2 times per week, moderate portions of poultry, eggs, and cheese and fermented foods, fermented dairy, so yogurt and cheese, and less often, once a month, meat, red meat, and sweets. We have consumption of wine in moderation, preference for water, and also other factors that you can see here at the bottom. So regular exercise, conviviality, so eating with our family, spending time together, which is very important, especially in this age. Talking with people, this is very important, avoiding, reducing stress by being around friends and family. And of course, using lots of herbs and spices and extra virgin olive oil. Is there any evidence that the Mediterranean diet helps? In psoriatic arthritis, in a multi-center cross-sectional study, it was shown that higher levels of disease activity were shown in those that did not adhere to the Mediterranean diet. So the more away people were from the Mediterranean diet, the worse their disease activity, showing potential benefits of this anti-inflammatory diet. So in this publication that we published together with Dr. Elena, a consultant rheumatologist, we actually showed that Mediterranean diet and fish oil supplements are beneficial in rheumatoid arthritis. And as I said at the beginning, there's no reason to believe that they don't also help in other rheumatic disease. The reason that a lot of evidence comes from rheumatoid arthritis is because this type of arthritis is more prevalent and there's more research on it. So we recommend the Mediterranean diet because it has benefits both on the disease itself and pain and function, but also, and very importantly, overall in terms of comorbidities. So that there is ample evidence to show that the Mediterranean diet helps with heart function, protects our brains. It also has anti-diabetic and anti-cancer properties. And overall, it helps with longevity and living a healthy life, not just living long, but also healthy. And we also recommend, as I showed before, that it might be of benefit to consume omega-3 in moderate amounts, either as supplements or in the diet, or maybe both. So consumption of fatty fish and seeds and walnuts is very important. So another message to put in your bag is that the Mediterranean diet or lifestyle represents a balanced approach for prevention and management of rheumatic disease. So what about the other dietary patterns that I showed you before? So what about the vegan diet, which is total elimination of any animal products? There is actually some evidence that it reduces symptomatology in rheumatoid arthritis again, including the decrease in duration of morning stiffness, articular index, and ESR. And if there is fasting and then followed by a vegan diet, it reduces the symptoms and there's possibly beneficial long-term effects in rheumatoid arthritis. And there's also decrease in swollen and tender joints, pain, and CRP. With fasting again, followed by vegan-based diet, compared to omnivorous diets. And we will come back to whether to consume a vegan diet or not in a minute. So what about the ketogenic diet? There's a lot of talk about the ketogenic diet. What is a ketogenic diet? It's mostly based on fat and some protein, and it reduces carbohydrates to very, very small amounts. You're not allowed to consume maybe more than half a slice of bread in the whole day, let's say. And this shifts metabolism towards ketone bodies. And there is evidence that a ketogenic diet will reduce pro-inflammatory cytokines and reduce inflammation overall. But why did I say that I would go for the Mediterranean diet in the long term as a safer approach? Because the other diets might involve unnecessary elimination of whole food groups, and they might not be balanced. And I need to say here that diet quality varies. So you might be someone who consumes a vegan diet and eats lots of vegetables, legumes, quinoa, and lots of different whole grain foods. And another person might be vegan and consume crisps and chocolates, dark chocolate, for example. So the different quality of the diet will vary based on the person's approach and the knowledge regarding the diet. If you are consuming a vegan diet, they need to be very well balanced to contain good protein sources, especially pulses and legumes. They need to include sufficient calcium and vitamin D, but they might still be deficient in vitamin B12, which needs to be taken as a supplement. It's important to consult with a dietitian so that a balanced diet will be provided. Now, with a ketogenic diet, the diet quality will vary. There is increased consumption of fat. Sometimes this includes a lot of saturated fat. But what worries me is that there is complete avoidance of fruit and some vegetables, legumes, and pulses, which we know are very important for the gut health. And I'll show you later on how gut health is also involved in rheumatic disease. So again, this you need to make sure that you are consulting with a dietitian if a ketogenic diet is to be followed. And I wouldn't recommend it in the long term. Elimination diets might be considered again under a dietitian, a registered dietitian, but only if necessary, because in the long term, there might be unnecessary avoidance of whole food groups and possible deficiencies without any actual reason. And the patient might have unrealistic expectations of what might happen using an elimination diet. So consult with a dietitian if you are to follow any of these diets and ensure that deficiencies, if any, are corrected in time. Now, another point that I wanted to make is something that's also in a lot of discussion at the moment of whether to consume gluten for rheumatic disease. So we recently published this editorial with Dr. Nikiforu, the rheumatologist. And the reason for this is because in rheumatic disease and celiac disease, where people cannot consume any gluten because this actually destroys their gut, there is shared immunological and autoimmune mechanisms. So it might be necessary to screen for celiac disease in people with rheumatic disease. But if one is to be screened, if they have some symptoms and they want to be screened, make sure that they are screened appropriately. So ask a medical practitioner who is knowledgeable on the subject to do that, not just in any other method. It's not just a case of taking out gluten from the diet and looking for changes in the symptoms. There needs to be screening using serum antibodies and also duodenal biopsy. The French Society for Rheumatology has published some recommendations, and they say that a gluten-free diet should not be followed by rheumatic disease patients in the absence of confirmed celiac disease. And the Medical Board of the National Psoriatic Foundation has also published some guidelines for people with psoriasis or psoriatic arthritis. And again, they say that this type of diet should only be followed by patients who test positive for these markers of gluten sensitivity. So why is that? Why not everyone? Because there's still risks associated with a gluten-free diet. Gluten-free diet might contain more heavy metals, and there is evidence to show that there is an increased risk of coronary heart disease and type 2 diabetes in people who follow a gluten-free diet, even if they need to follow it. And if they don't need to follow it, there are unnecessary restrictions, and the variety of the diet might be lower. If one is to follow, though, a gluten-free diet because they need to and they have tested positive for the serum antibodies, then what we recommend is to choose mostly naturally gluten-free foods, which are legumes and lentils, whole grain and wild rice, quinoa, millet, buckwheat, corn, potatoes and sweet potatoes, fruits and vegetables that are in season, seeds and nuts, and gluten-free whole grain oats. These are to be preferred, and the manufactured gluten-free foods need to be consumed only in moderation and when necessary. This will make the diet more healthy. So another take-home message to put in your bag is that we need to consider that always rheumatologists, dietitians, and patients should discuss options on diet, according to individual need, and jointly make decisions about changes in dietary patterns, of course, keeping in mind sociocultural and other factors. So now let's move to the point, to the consideration of comorbidities. What about cardiovascular disease? Inflammation, as we said at the beginning, increases the risk of comorbidities as well. And inflammatory rheumatic disease increases the risk of atherosclerosis and vascular events. As you can see in the figure, inflammation affects all the different organs, the liver, the muscles, the heart, the brain, the bones, everywhere. As an example, in systemic lupus erythematosus, there is elevated VLDL and triglyceride and low HDL, so the good cholesterol, and this is directly correlated with the disease activity scores. Now, to improve cardiovascular risk, the consumption of oily fish is central again. So omega-3 fatty acids improve inflammation and reduce also triglycerides and improve the blood lipid profile. Extra virgin olive oil is very important to consume 2 to 3 tablespoons per day because of its high content in monounsaturated fatty acids and also polyphenols, which reduce inflammation. And extra virgin olive oil also increases HDL, so the good type of cholesterol in the body. Oats contain beta-glucans, which reduce total and LDL cholesterol. About a portion a day, 50 grams of whole oats per day can do the job. And then consumption also, again, as we see here, of unsalted nuts has been shown to be very beneficial in cardiovascular risk. So walnuts and almonds, they reduce cholesterol and reduce inflammation. about a handful per day. It's good to consume. Another important food group is pulses, legumes, fruit, and vegetables, because they contain plant stanols and sterols. You can also find this in fortified spreads, drinks, or yogurts. And avoidance again or reduction of saturated and trans fats found in fat meat, fried foods, savory and sweet snacks. All of this will increase cholesterol and the bad cholesterol, as we say, the LDL cholesterol, but also reduce HDL cholesterol, but also increase body weight in the long term. Another comorbidity is obesity. So as shown here in the study by Dr. Nikiforu, the higher the body mass index, the higher the person's weight for their height, the worse the disease activity. And this was shown over time as well. But the good news is that weight loss is really a critical factor in reducing inflammation. So weight loss and exercise training, what it will do, it will have a direct effect on our innate immune system, reduce pro-inflammatory cytokines, and also it will have a direct effect on the fat, the adipose tissue, to reduce pro-inflammatory mediators and increase the anti-inflammatory mediators, therefore overall reducing the pro-inflammatory state. And I can tell you from my experience that when people start eating healthily and losing weight, they feel it even before they start losing weight. When they start eating healthily, they feel that there is a reduction in pain. They feel better in themselves, even from the first week. So I want to ask you, based on what we talked about, but maybe also your general knowledge on how can weight loss benefit? Do you think it reduces the risk of cardiovascular disease? Do you think it reduces the risk of type 2 diabetes mellitus? Do you think it helps to improve mood? Does it reduce inflammation? Or does it reduce pain? And again, you can choose more than one answer. Okay, so that was easy. Everything, weight loss does everything, all of the above. And actually, in a study recently published by Kleinberg et al., it was shown that weight loss is associated with even a sustained improvement in disease activity and cardiovascular risk factors in patients with psoriatic arthritis and obesity. So after weight loss, the weight maintenance period, still the patients were seeing the difference. And here you can see the study where the number of patients with minimal disease activity was higher even after 12 and 24 months following the weight loss diet. And the change in BMI correlated with the change in disease activity, but also the change in inflammatory markers. So losing weight and keeping the weight off was showing improvement in their disease. So another take-home message, weight loss, if necessary, using a safe approach, including diet and exercise, can really benefit people living with rheumatic disease. So what about vitamin D? Because I know a lot of you are interested in hearing about vitamin D and whether this is necessary to take or not. So we have evidence to show that in rheumatoid arthritis, low vitamin D is associated with a high disease activity and also a worse response to treatment. In spondyloarthritis, that vitamin D deficiency correlates with disease activity, but also extra musculoskeletal manifestations such as gut inflammation. And in systemic lupus erythematosus, we have evidence that patients with lower vitamin D were more likely to have metabolic syndrome, which increases the risk of cardiovascular disease and also higher insulin resistance. So because vitamin D is important in preventing osteoporosis and osteopenia, it is important to test for vitamin D deficiency and take a supplement as appropriate, obviously under the medical practitioner's advice. But let's look at also what other nutrients are important for osteoporosis and osteopenia before we come back to vitamin D. So in addition to vitamin D, which is the second one, which can be found in fatty fish, egg yolk, fortified products, such as breakfast cereals and milk, but you might need to take a supplement because the food sources are not a lot, and they might not cover someone who is deficient in vitamin D. And also, it's necessary to have some exposure of the skin, sun exposure of the skin, which might not always be possible. But if you do that, you need to be really careful with avoiding sunburn. So it is important to consider supplement under the medical practitioner's advice, but first get tested. So another nutrient that obviously very important for prevention of osteoporosis and osteopenia is calcium, which is necessary to have 3 to 4 portions of dairy products, especially fermented dairy products, such as yogurt, dark green leafy vegetables, such as spinach, broccoli, nuts, and fish with edible bones is a good source of calcium. Also, magnesium is important for prevention of osteoporosis, which can be found in spinach, in dark chocolate, raisins, tomato products. Vitamin C is important, found in oranges, strawberries, berries in general, red peppers, tomatoes. Vitamin K, again, dark green leafy vegetables, and potassium, like in tomato products, raisins, potatoes. All of these are especially important for prevention of osteoporosis and osteopenia. But as I said before, vitamin D supplementation should be considered in patients with deficiency because intake from the diet might not be enough if one is deficient. Although saying that, evidence on other vitamin supplementation is limited, and there's no evidence to say that one will benefit from taking any other supplements if they're not deficient in that nutrient, or if their diet is not limited in that nutrient. So what about the gut microbiome? There's a lot of evidence that a lot of the anti-inflammatory factors that we produce and the different cytokines are actually produced in the gut. So it's very important to keep a gut healthy and keep a gut happy, actually. And to do that, we need to all be consuming prebiotics and probiotics on a daily basis. So prebiotics are those foods for our gut bacteria, which are non-digestible fibers and thus help our gut microbiome, so the good bacteria in our gut, to grow and stay healthy. And these are found in foods such as asparagus, artichokes, bananas, beans, peas, oats, onions, leek, garlic. So we can choose and consume some of these every day. And then it's also important to consume probiotics, which are the live bacteria found in foods and also supplements. So foods that are rich in probiotics are kefir, sauerkraut, which is fermented cabbage, tempeh. You can also make your own at home. You can easily find some recipes on YouTube to do that. And evidence shows that it's important to consume a few portions of both pre and probiotics on a daily basis. Another important thing is to consider the circadian rhythm. So circadian rhythm is our body clock. So the biological clock that tells our body what time it is in the day and makes us awake in the morning and sleepy in the night. So there is evidence to suggest that the time that we eat, called chrononutrition, affects this circadian rhythm. And thus, it's important to consume appropriate food at regular times and try to keep a regular pattern of food consumption and avoiding consuming a lot of heavy food in the late hours of the day. And also maintaining a good sleep hygiene. Cannot stress that enough. So for the last part of this presentation, let's look at some more practical advice. What is a healthy meal in the end? So a healthy meal is not one that contains a lot of red meat, a lot of fried foods, but one that contains a lot of pulses Lots of color, as you can see here, whole grains, different vegetables, fruits, and different seasonal foods. But I know that everyone is busy, and it's important to consider how can one eat healthily when busy. And for this, let's look at how we can set some smart, healthy eating goals. So set some goals which are actually realistic, first of all, specific to be smart, measurable. So how much or how many would you add or change? And then achievable. Do you have what it takes to follow through? And as I said, realistic. What can you do? So remember that the important thing here is to improve rather than perfect a habit that we have. And then the T stands from time-based. So how often or for how long will you make a change in order to say that you have achieved your goal? So how can we set some smart, healthy cooking goals if we are very busy and not having enough time to cook? So we can say, for example, and I've taken this from my dear colleague, Dr. Mosquera, that I will cook a healthy dinner at home each week for the next month, starting the following Monday. This is specific because I decided to cook healthy dinners. It's measurable because it's 3 dinners a week, so I can track my progress. Have I done 2? Have I done 4? How many have I done? It is achievable because it's going from 1 day a week. Let's say I was only cooking 1 day a week to 3 days a week. And then I can stock and use the food that I cook on 1 day for the next. It is realistic, so I'm not expecting to cook every day or every night, and I will try it out for a month and see how it goes. And it is time-based. It says I'll start on Monday and I will do it for a month and then review my progress. So this is how I can set a smart goal for healthy cooking. Another important thing that I found that people have trouble with is that they tend to eat healthily in the morning and perhaps lunch, and by the afternoon, everything goes out of the window. So it's important to have healthy snacks available so that we know what we'll snack on, maybe at work or when we come home and we're tired. So healthy snacks can be fruits, can be vegetables that are cut and ready to eat, can be some energy balls that contain a lot of oats, here, these ones contain goji berries and raisins and dark chocolate. And also consumption of fruit with unsalted nuts or unsalted butternuts, which is a very nice combination. So how can a day look like then? I can have for breakfast muesli or oats, jumbo oats with pecan nuts and some fruit. A snack can be here is apple with peanut butter, unsalted peanut butter, just 100% peanut butter. Lunch can be based on pulses and beans and some brown pita bread, salad and fruit. Snack can be some nuts, and also on the different snack times I added some yogurt, probiotic yogurt or other probiotic drink. And then dinner can be a salad based on chicken, some cheese on top, or some fish salad to consume more omega-3 fatty acids. So when you leave this seminar, I want you to consider which one smart goal would you set to improve your diet or lifestyle, starting today or tomorrow if you want. So it's important to be realistic, as we said, and remember that smart goals need to be what the name says, smart, not something that it's ideal, but something that can be achievable and you can do in the following couple of weeks, let's say. So to finish off, these are our take-home messages for today. Nutrition does play a role in inflammation and is implicated in the onset of rheumatic disease. The Mediterranean diet or lifestyle represents a good balanced approach to recommend. High consumption of sugar, salt, and fat should be discouraged. Regular physical activity and weight loss where necessary should be encouraged, but this should be under a safe approach. Food should be consumed at regular times, and good sleep hygiene should be adhered to. If we want to make any dietary changes, it's important to set smart eating goals. Vitamin D and omega-3 supplementation should be considered, but always under medical supervision. And rheumatologists, dietitians, and patients should discuss options according to individual need and jointly make decisions about dietary changes. And before I close, I really want to acknowledge and thank Dr. Elena, who is a consultant rheumatologist at King's College Hospital, and with whom we have published a lot of papers on rheumatic disease, and also developed a lot of what I showed you today. So thank you to Elena. And if you need any of the references, you can see them here. Thank you very much.
Thank you, Dr. Philippou. So we are now going to move into our Q&A portion of this session, and I've already received a ton of questions, and so we will try to get to as many of them as we can for the last 30 minutes of today's session. So first question, is taking an omega-3 fatty acid supplement equivalent to eating the oily fish?
The question was, is it equivalent?
Yes. Would it be the same as eating fish?
Mm-hmm. This will depend on the dose, okay? So it's important, if taking an omega-3 fatty acid supplement, to check the dose of the EPA and DHA, not just the amount of fish oil, but the amount of omega-3 in the supplement. So I would say that if you're taking a supplement, you would know exactly the dose, but what you're missing out is the other benefits of eating fish. So fish will contain other nutrients such as phosphorus, vitamin D, vitamin A, lots of other nutrients as vitamins and minerals. And also, it might be the case that if you're consuming fish, you're not eating meat. So you are having double the benefit of not eating, reducing the amount of meat that you're consuming and you're consuming fish in its place. So I would say overall, if you cannot consume fish, then you can go for the supplements. But if you can consume fish, it's important to also consume fish and perhaps have the supplement as an addition. So as the name says, supplement the diet with the supplement, the pill.
Okay, thank you. We know that even sweetened beverages, as with sucralose or other sweeteners, cause the brain to tell the body to release insulin, contributing to insulin resistance. So switching to diet soda doesn't really help. Do all sweeteners cause this? Stevia, monk fruit, for example?
Okay, so this is a very interesting question. There is some evidence now coming through that different sweeteners affect the gut microbiota. So they actually affect the bacteria that live in our gut. And through that way, they increase insulin resistance in the body, not in everyone, but in some people. So even diet soft drinks might, and sweeteners in any food really, might cause insulin resistance, which, as you know, is related to increasing the risk of type 2 diabetes and cardiovascular risk. We don't have any evidence on stevia to show that it is problematic at this stage. So I would say that if you were to use a sweetener, I would recommend stevia, or try to reduce generally the consumption of sugary foods.
Okay, thank you. Does cheese count as fermented dairy, like yogurt?
Yes, cheese is fermented also. It's considered a fermented food. And in terms of using, I mean, if if you want to increase the probiotics in the diet, I would put cheese at the bottom of the list. So it's not going to be the most beneficial in terms of changing the gut microbiota, but it is a fermented food. So I would go mostly for live yogurts, kefir, which is really lovely. You can mix it up in different with different fruit if you don't like it straight. And cheese would be fermented, but it would not have the same benefit on the gut bacteria as yogurt, but it is a fermented food. And it is preferable to milk because it is fermented.
Okay, thank you. What is the best and most palatable way to incorporate flax and chia seeds into a diet?
Okay. I would say based on, let's say based on my preference, I would say the most preferable way would be in seeded bread. So you can make your own bread or buy seeded bread, so bread that contains already these seeds. And then also in porridge. So you can mix oats with some milk, some nuts, some seeds, even add, if you want, some dark chocolate in that, and mix it up and warm it up, or some fruit. And when you mix all of this up, it will really make a nice gel. Another way that people use, and is kind of becoming in fashion, is making a gel using the chia seeds. So you mix together some chia seeds with some milk or plant-based milk if you don't use milk, and some fruit. Let's say you blend some mangoes or bananas, and you make like a smoothie, and you leave it overnight, and it swells up, and you can have it as a smoothie. And then again, in salads also, you can use seeds in salads.
Okay, thank you. Can you, are there any fruits or vegetables that we should avoid as they are pro-inflammatory? For example, tomatoes.
Mm-hmm. Okay, so this is a question that comes up frequently. In essence, no. But if you have any symptoms that you have noticed arise after consumption of a specific food time again, so you notice that every time you eat a specific food, you have some symptoms, you can speak to a registered dietitian who can help you to eliminate that food from your diet and see if it helps with the disease symptoms. So it shouldn't cause that, but if you have noticed it, then perhaps there is a hypersensitivity to that food. In general, though, I would go for what is more in season, seasonal fruit and vegetables, and if possible, locally produced.
Okay, thank you. Do you recommend regular milk or soy milk?
Okay, so I would recommend let's put the question a little bit differently. There is some evidence that high consumption of regular meat might be associated with some types of cancer. But I don't want to scare people off, because the evidence comes from consuming more than, let's say, 1 glass of regular milk per day. So I would say that if one is consuming a lot of milk, they might consider using a plant-based milk. If one is only using a small amount of milk, then perhaps just in some of their beverages, then there's no problem consuming regular milk. It depends on the amounts. So until perhaps we know more based on the evidence on this type of disease.
Okay, thank you. Can you speak on the role of turmeric and curcumin supplements?
Mm-hmm. Okay, so there is some evidence that curcumin reduces inflammation, and I would definitely use curcumin in foods. So for example, even at lunchtime today, we made some mincemeat and we added some curcumin in there, and you can even use it in things like porridge and drinks. Now, in terms of supplements, if one is to take a supplement, then I would say use that for 3 months and see if it makes any symptoms, any changes to your symptoms. And always make sure that you buy these types of supplements from places that are regulated as much as possible. You know, a regular shop, not or a pharmacy, rather than or online, let's say.
What are your thoughts around whey protein powders?
In what context? To gain muscle?
General question. Do you have an opinion? Are they good to use, do you think? Do they?
Okay, so in general, using protein powders, there needs to be, for me, there needs to be a reason for using those instead of food. Okay, so for example, if one is wanting to gain muscle mass and they want to go to the gym, and after the gym they don't have any time to eat protein source, for example, then they might use a scoop of a protein powder to get their 22 grams of protein and be sure that they have covered their protein needs because they're wanting to gain muscle. But I would prefer if they were using, let's say, some yogurt to do that. But if it's a matter of convenience, they can use a scoop, but I wouldn't say more per day, because consumption of a lot of protein and it might not be beneficial, and in the end, it might cause problems that in the long-term use.
Okay, this person says they have low blood pressure and they often crave salt. Is there a substitution that I could make to avoid eating salt but still resolve my cravings?
Okay, I would discuss that with the doctor, because the low blood pressure, sometimes it's the normal blood pressure for that person. It would be good to check with the doctor. Perhaps they need to get a continuous blood pressure monitor, one that will do a 24-hour, you know, every half an hour it would measure their blood pressure. The first thing I would advise that person to do is drink more water, because that would help them to increase their blood pressure. So they don't necessarily need more salt, but perhaps more water. But speak to the medical professional to see if they are actually, they do actually have low blood pressure, or it's something else that they have, and it's causing them to feel that they're craving salt, and they think it's a blood pressure, because this is not a usual phenomenon to see.
Is it more beneficial to eat oats whole, or can you blend them in things like smoothies, etc.?
Okay, so yes, it is more beneficial to eat them whole, and actually it is even more beneficial to eat them in the unprocessed form, so as jumbo oats, so big oats, rather than, the more you process oats, the more basically you increase the glycemic index, so the higher the response in the body would be in terms of sugar. So basically, think about this as like you're pre-digesting the food and you're not allowing the body to do its job. You're doing the job for the body before you eat the food. And therefore, when you eat the food, it's very easy for the body to increase the blood sugar by taking that sugar from the food and getting it out into the blood. So as much as possible, it's better to eat the food in its whole form, any type of food, oats or any other food, in its whole form, instead of blending it. Now, if you were to ask me, I wouldn't eat it at all if I wasn't to blend it, then obviously blend it if that's the case, you wouldn't eat it at all. Or if you do a combination, let's say you have your oats whole and sometimes you also have a shake that you blend those oats, then you can do that. But what I would say also here is that if we're taking oats as an example, you'll find that there are many ways that oats are used in processed foods. So, for example, you can find oats that are blenderized together with sugar and other, other nutrients or whatever it is, and then they end up becoming a food that is what we call ultra processed food. So something that contains different materials that we wouldn't have in our own kitchen, and this is what we don't want. So it's different if you blend them at home, and it's different if you buy something that already contains blended oats or any other blended foods in general.
In your research, can you address the low or no starch diet and the claim that many people who have AS have successfully lowered their pain markers using that?
Without any carbohydrates, by
it's a low or no starch diet, yeah.
Okay, so this is what we talked briefly before about elimination diets. So some people will find that some foods exacerbate their symptoms, and they can work together with a dietitian who is who has experience in this issue, to eliminate those foods from their diet and see if it improves their symptoms. It might be that they improve their symptoms because they reduce actually insulin resistance and inflammation. So what we showed before, so these high peaks in the blood of blood glucose would increase inflammation. And what they do by removing these carbohydrate sources that cause these high blood glucose peaks, they are reducing inflammation. That's why they feel better. But if one is to remove those food groups, they need to consider what they would add instead. So, for example, they might want to add some legumes, some beans, some lentils, in order to have some good, slow release foods in their blood, in their body, that will actually provide them with the nutrients that they're losing because they're not consuming anymore those starchy foods. So overall, if one is to do this carefully and look at their diet overall, it should be fine, but it depends on what they're doing. If one is just taking out those foods and only consuming chicken and salads or fish and salad, then they're not having a balanced diet, and they need to change that, improve that.
So a follow-up on the blended question, does whole form versus blended, does that apply to fruits and vegetables as well? In other words, is it best to eat everything in its natural form?
Yes, absolutely. So, for example, if we go back to the glycemic index curve, the one that I showed you that goes up and comes down, we know that if we're eating a food in its whole form, then we have a slow release of glucose into the blood, and the hormonal response is much more natural. It doesn't have a peak, and it doesn't have this sudden reduction in blood glucose that would be caused by blending foods. So we want to be eating foods, whatever it is, if it's fruit, if it's vegetable, in its whole form as much as possible.
Is olive oil pro-inflammatory?
No, olive oil, actually extra virgin olive oil, is very much anti-inflammatory. Apart from the fact that it contains the anti-inflammatory type of fat, MUFA, monounsaturated fatty acids, it also contains polyphenols. And these polyphenols come from the fact that olive oil comes from olives, and olives is a plant, is a crop. And these olives have a lot of polyphenols that have anti-inflammatory properties. So they really help to reduce inflammation. And even in the context of any disease, not just rheumatic disease, but in the context of diabetes, in the context of cancer, in the context of cardiovascular disease, olive oil is important for reducing inflammation. So it is the oil to be preferred.
What about avocado oil?
Avocado oil is also good. It's not so easy to use in cooking as olive oil, but if it's available, it's also a good source of MUFA. There's more evidence on olive oil though, because avocado oil is not so well spread. So there's not so much research on that. But avocados are good. And another thing about avocados is they also help with the gut microbiota. So consuming avocado has been shown to improve our gut microbiota profile.
Thank you. Are rice cakes in general considered unhealthy, even whole grain rice cakes?
Okay, so it's not that it is unhealthy. So when something has a low glycemic index, a high glycemic index, excuse me. So for example, baked potatoes, they have a high glycemic index. That doesn't mean they are unhealthy. It means that it's best to try to consume them more in moderation. And if possible, to reduce the glycemic index, we can consume them with something that has a low glycemic index. So for example, if I wanted to have a rice cake, then what I can do is have together with that some peanut butter, whole grain, 100% peanut butter, or some avocado, for example. That is a type of fat, and fat will reduce my response of glucose to that food. So if you like rice cakes, then yes, you can have whole grain. There's also seeded rice cakes, and consider what you're eating that with, and not have it in large amounts. So not have too many. But consider the fact that if you are having rice cakes and you're feeling hungry after a bit, then maybe it is because your blood glucose is going up and then down. So see also how you feel with the food when you are consuming it. But I wouldn't say there's one food that you should never have, or you should completely stay off. It's the amount and the dosage that makes the poison, isn't it?
We had a couple questions to follow up on that. What about heating olive or avocado oil? Does it change how healthy they are if they're, put in a pan and heat it up?
Mm-hmm. Yeah, yes, it makes a difference. So for example, every different oil has their boiling point. So how much they can actually allow us to heat them up, and we shouldn't heat them up to an extent that we are causing the oil to be destroyed. So for example, extra virgin olive oil, because it has these polyphenols in them, which are protecting the oil, it's better to use compared to avocado oil. So some oils are best to use without cooking, so just raw compared to cooking them. And even with olive oil, it's best to add it towards the end of cooking so that we're preserving these qualities rather than destroying them.
Is the incidence of RA and AS less in the Mediterranean countries? Because more people in these countries eat this diet. Do you know?
Okay, that's an interesting question. I haven't seen any evidence on whether the incidence is lower or higher, but it would be interesting to look that up. Up to now, I'm not aware of any evidence, but I will make a note to look it up and see what I find.
Can you talk about the cow milk casein pro-inflammatory effects from different? Yeah, cow milk casein pro-inflammatory effects from different cow breeds. I don't know if you have any information about that.
Casein from cow milk? Is that what they ask?
Yes, ma'am.
Okay.
Or the casein is in the protein in the milk, she clarified.
Yeah, casein is a protein in milk. I'm not sure what is the question though. Whether it's pro-inflammatory, is that the question?
Is it pro-inflammatory? And then apparently she asked about questions related to the breed of cow, and that might be a little more specific than you probably.
Yeah, I mean, I'm not 100% sure because it might fall a little bit out of my area. But what I know is that in the US and in Europe, there are different regulations in terms of use of hormones, for example, for cows, if the question is related to hormonal use. And the regulations are different in the US and in Europe regarding that. So the evidence, for example, that I mentioned before about some evidence that increasing amount of milk consumption is related to some types of cancer, which are mostly hormonal cancers, perhaps come mostly from the US, where there is a use of hormones to make the cows produce more milk. So these hormones might have effects on the estrogens and the other hormones of the persons consuming them. That's why I said perhaps consider consuming milk only in moderation. And if you're using a lot of milk, then maybe you want to go for more plant-based, like almond milk, for example. I'm not sure whether that is the question, but this is what I can comment on.
Okay, thank you. Let me see. Can you expand on the risks with gluten-free diet? How does it increase the risk of heavy metal exposure?
Okay, so basically, people consuming gluten-free diets usually consume more rice. Rice might contain arsenic acid, which is a heavy metal. So this is the reason why the research is not my research, but the research has shown that those people consuming the gluten-free diet in the end up consuming more heavy metals. And the other reason that that they are at higher risk of cardiovascular disease and type 2 diabetes, we believe comes from the fact that a lot of these people go for those foods that are mostly coming from processed foods. Okay, so they just go to the supermarket and they buy everything that they see gluten-free without considering whether this is a natural gluten-free food or a packaged gluten-free food. Because if you are consuming legumes, this is gluten-free. But if instead of legumes, you're considering consuming all the time all the processed foods that have a lot of sugar in them, a lot of salt in them, a lot of different fats that might be increasing cardiovascular disease, then this is the reason that it is believed in the end people might be more at risk, or it has been shown actually that people were more at risk of cardiovascular risk. So it's not directly because of gluten or avoiding gluten, but it is the what foods are chosen to eat instead of those foods that they would have consumed if they were consuming gluten. So it all comes down to the person making sure that they're eating foods that are naturally gluten-free on most occasions, and avoiding too much rice, not relying on rice all the time.
Okay, thank you. This is going to be our last question because we're running out of time. But what testing do you recommend for identifying food intolerance or microbial overgrowth, such as candida?
I would recommend seeing a gastroenterologist for that. So, or first of all, the general GP, and then speaking to a gastroenterologist together with a rheumatologist, because a lot of the different tests that are out there, they are not reliable. They just take some blood and they test the blood outside of the body. So if one has intolerances or allergies, it's not always very easy to find, and they need to have specialized advice from specific doctors on that. There's not one specific test that will give you the answer, unfortunately.
Okay, well, thank you so much, Dr. Philippou. We really appreciate you sharing your time with us today and your extensive knowledge and expertise. And so, again, I want to thank you very much for sharing your time with us. It's been excellent.
Thank you very much. It was a pleasure to be with you, and the audience has given me the chance, very excellent questions to answer. I'll get back to you regarding the incidence of rheumatic disease in Mediterranean countries. That's an interesting point.
Well, we are going to wrap up.